Epidemic and Pandemic Preparedness and Prevention. Then we have Dr. Abdirahman Mahamud. He's Director ad Interim for Alert and Response Coordination. To his side is Dr. Anna Maria Henao Restrepo. She's the lead for R&D Blueprint for Epidemics. And here on the other side, we have Dr. Teresa Zakaria. She's unit head for Humanitarian and Disaster Action. Now we have a long list of colleagues online. And let me start with our country representatives. Now, first, Dr. Burema Hama Sambo. He's WHO representative to the Democratic Republic of the Congo. Then we have Dr. Shible Sabani, WHO representative to Sudan. We also have Dr. Kazonde Mwinga, WHO representative to Uganda. And we should have Dr. Michel Thieren. He's WHO special representative in Israel. We also have a number of other colleagues online. First, Dr. McDougherty, she's Director HIV, Hepatitis, and Sexually Transmitted Diseases. Then we have Dr. Kate O'Brien, Director of the Department of Immunization, Vaccines, and Biologicals. Dr. Adelaide Marshang, Emergency Response Coordinator for the Democratic Republic of the Congo Crisis. We also have Dr. Anaïs Legon, Technical Officer for Viral Hemorrhagic Fevers for WHO, and an overview on the Ebola diseases. Then we have Dr. Egmont Evers. He's Acting Incident Manager for the Greater Horn of Africa. And I think last but not least, we also have Dr. Andre Ilbavi, Technical Lead for the WHO Cancer Control Program. So with this, it's a long list. And before I invite the Director General for his opening remarks, let me just remind everybody, if you want to get into the queue for questions, please raise your hand and also clearly identify yourself in the system. Otherwise, we will not be able to take you if we cannot see where you are from and who you are. So with this, thank you very much. And now let me invite the Director General for his opening remarks.
Thank you, Christian. Good morning, good afternoon, and good evening. As you know, yesterday, the WHO Executive Board concluded its first meeting for the year. The Executive Board is the second most important decision-making body in WHO after the World Health Assembly. This year, the board dealt with a large agenda covering the huge range of WHO's work: emergencies, polio, meningitis, cervical cancer, medical devices, air pollution, universal health coverage, and so much more. To support WHO's work around the world, the board recommended that the Health Assembly approves program budget for 2026 and 2027. The board also recommended that the Health Assembly approve the next 20% increase in access contributions, the membership fees that countries pay. In 2022, member states agreed to gradually increase access contributions from 16% of the base budget to 50%. The increase approved by the board this week is the next step towards that target and is critical for putting WHO on a more sustainable financial footing. Now to the Ebola outbreak in Uganda. So far, the government has reported 9 confirmed cases, including 1 death. More than 260 contacts have been identified and are being monitored. I thank the government of Uganda for its leadership and partnership. WHO is on the ground supporting the government's response. We're providing surge support for surveillance, laboratories, logistics, infection prevention and control in hospitals, treatment centers, and research. National emergency medical teams trained by WHO are providing care for those infected, and we're providing critical supplies from our logistics hubs in Nairobi and Dubai. There are no authorized vaccines or therapeutics against the species of Ebola virus responsible for this outbreak. But thanks to preparedness measures that the government took after the previous outbreak and the global research collaboration led by WHO, we were able to start a trial of a candidate vaccine just 4 days after the outbreak was declared. A therapeutics trial will start as soon as national authorities provide approval. To support the response, I'm releasing $2 million from the WHO Contingency Fund for Emergencies. This is in addition to the $1 million that we contributed earlier to set up the initial response. I thank all donors and partners for supporting the response. Now to the recent surge in violence in Eastern Democratic Republic of the Congo, which has led to significant loss of life, injuries, displacement, and the destruction of critical health infrastructure. More than 900 deaths have been reported and more than 4,000 injuries. At most, only 1/3 of people who need health services in North and South Kivu are able to receive them. Pregnant women cannot reach health facilities for safe delivery. And the threat of infectious diseases, including mpox and cholera, has multiplied. Hospitals and morgues are overwhelmed. Some health workers have had to flee, while others have been working around the clock for days. WHO remains on the ground, although insecurity is limiting our operations. Anticipating an escalation of violence, we have been working since November to pre-position supplies, including medicines and fuel. However, these supplies are running out and others are running dangerously low or have been looted. We're continuing to respond as best we can. As always, the best medicine is peace. Now to Gaza. Since the ceasefire began in January, WHO has sent 139 trucks with supplies for 1.6 million people. We're expanding our operations and pre-positioning supplies at health facilities. We have supported the evacuation of 414 patients and 588 companions. We have also sent emergency supplies to hospitals in response to the escalating violence in the West Bank. WHO has just published our recovery plan for providing life-saving assistance to the people of Gaza while working on rebuilding and strengthening the health system. We urge all sides to ensure the ceasefire in Gaza holds, hostages are released, and the violence in the West Bank stops. A significant part of WHO's response to health emergencies in Uganda, DRC, Gaza, Sudan, and elsewhere is supported by funding from the United States. As we have said, we regret the announcement that the United States intends to withdraw from WHO, and we would welcome the opportunity to engage in constructive dialogue. There are also actions that the US government is taking that are unrelated to its intended withdrawal from WHO, but which we're concerned are having a serious impact on global health. For example, the suspension of funding to PEPFAR, the President's Emergency Plan for AIDS Relief, caused an immediate stop to HIV treatment, testing, and prevention services in the 50 countries that PEPFAR supports based on bilateral agreements. Although a waiver has been granted for life-saving services, it does not include prevention services for some of the most at-risk groups. Despite the waiver, clinics are shuttered and health workers have been put on leave. WHO is gathering data on service disruptions and supporting countries with mitigation measures, including by filling gaps in supplies of antiretrovirals. The sudden suspension of US funding and the sudden disengagement of US institutions is also affecting the response to global efforts to eradicate polio and the response to mpox epidemics in Africa. In Myanmar, almost 60,000 people, most of them women and children, have been left with no access to life-saving services. And we have limited information about the spread of avian influenza among dairy cattle in the US or human cases. We ask the US to consider continuing its funding at least until solutions can be found. Finally, every year, an estimated 400,000 children worldwide develop cancer. In high-income countries, almost 90% of children survive. In low and middle-income countries, survival rates are often below 30%. In 2018, WHO established a global initiative on childhood cancer with St. Jude Children's Research Hospital in the United States and more than 100 other partners. As part of the initiative, WHO and St. Jude have also established a global platform to improve access to life-saving medicines for children with cancer in low and middle-income countries. Yesterday, we began distributing childhood cancer medicines at no cost in the first two countries, Mongolia and Uzbekistan. Further shipments of medicines are planned for another 4 countries, Ecuador, Jordan, Nepal, and Zambia. We estimate these treatments will reach about 5,000 children with cancer across at least 30 hospitals in 6 countries this year. 6 more countries have been invited to join the platform, and over the next 5 to 7 years, we aim to reach 120,000 children in 50 countries. We're very encouraged to see how this program has grown since we started in 2018, and we thank St. Jude for its partnership. And Christian, back to you.
Thank you so much, Dr. Tedros. And with this, we'll open the round for questions again. Please raise your hand with the raise your hand icon in order to get into the list. And the first goes to EFE. Antonio Brotto from EFE, please go ahead.
Thank you, Christian, and thank you, Mr. Tedros. My question concerns Argentina's recent announcement that it will leave the WHO following the footsteps of the United States. What is your reaction, and do you fear this is leading to further exits and the formation of a global health system divided into blocks in the future? Thank you very much.
Thank you very much, Antonio. I believe we have Steve Solomon, our principal legal advisor, on the phone as well. If so, no, we start with the DG.
No, I will take that. So thank you for that question. We regret the announcement by Argentina, and I hope they will reconsider their decision and look forward to engage them. Thank you.
Thanks so much. Next question goes to Helen Branswell from STAT. Helen, please go ahead and unmute.
Thank you very much for taking my question. I wanted to follow up on a couple of things the Director General said in his opening comments. Do I read you correctly that you have had no engagement with the United States in terms of you said you would welcome the opportunity to have dialogue. Has there been none? There is no openness there to discuss possible other routes? And you also said that the WHO has limited information on avian influenza. Is the United States not abiding by its requirements under the international health regulations to report cases of avian influenza to WHO? Thank you.
Thank you very much. We'll start with Dr. Van Kerkhove.
Yeah, thanks very much. So I'll start with the second part of your question, Helen. So US is reporting cases of avian influenza through IHR channels. So we have had reports of a H1N2V, a swine virus through IHR, a human detection. We've also had a human case of H5 that has been reported through IHR channels. CDC right now is not reporting influenza data through the WHO global platforms, FluNet, FluID, that they've been providing information for many, many years. And we have not had direct communication with CDC related to influenza. We are communicating with them, but we haven't heard anything back. We are receiving information on avian influenza through animal infections. USDA has published some information online, so we do know about some circulation that's happening in dairy cattle. But as DG has said, we welcome active technical exchange with our colleagues in the US. And there are very important meetings that are taking place, and we welcome, as always, the engagement of our technical partners in the US as well as through all of our member states, and in fact, technical exchange with anyone, anywhere. Thanks.
Thank you. With this, we go to the next question. That goes to Nina Larsen from AFP.
Hello. Can you hear me?
Now it's better. Yeah, now we do.
Yeah, I wanted to follow up on that. In terms of the information that you're receiving from the US, are you confident that they are doing enough surveillance, and also that they are communicating the cases that are arising, or that there is a bit of an overview in case dangerous changes occur? And I also had a follow up on the question on Argentina. I was wondering if you could say, I know that the US withdrawal, it'll take 1 year. I think that was only the US that had that rule. So does that mean that Argentina has already withdrawn from the WHO, and what impact will that have on the organization? Thank you very much.
Yeah, we'll start again with Dr. McKirkhoff.
Yeah, thanks. So I assume your question, Nina, was related to avian influenza, although I don't think you put that in the question. The US has a very strong surveillance system for influenza. And prior to a few weeks ago, we had active dialogue with our colleagues at US CDC, with HHS, with FDA, with USDA, with many. And the reporting was coming through online platforms like I just mentioned with FluNet and FluID, but also through technical exchanges that we had with them on a regular basis, regular calls. We are confident that the US has detection capabilities to identify zoonotic influenza in animals, in humans who are working with exposed animals or infected animals. We encourage the dialogue to continue with us and that technical exchange. We encourage reporting through IHR, and they are continuing to report through IHR. We had been very active in working with US, with our WOHA colleagues, with FAO colleagues to strengthen surveillance in animals, particularly in dairy cattle, to see what more could be done at looking at preventing transmission between herds to new animal species, to look at biosecurity on farms. And that work was starting, that work was underway. We are doing this in a number of countries around the world because zoonotic influenza is a risk globally. So there is a strong surveillance system that is there. There are reporting mechanisms that exist. And as the DG has said, we encourage that reporting to continue through the online platforms that they have and for the dialogue with us to continue.
Thank you very much. Then we should go maybe to Steve Solomon again, our principal legal advisor for that second part. Thank you.
Christian, thank you. So the question of Argentina or any country withdrawing from WHO has a number of dimensions to it, including legal and historical. It's fair to say in this sense that it is not straightforward. So as a legal matter, the WHO Constitution, the UN Charter, does not have a withdrawal clause. This was because the drafters of the Constitution were aware of the importance of global health being addressed in a way that is truly universal, so as to leave no one behind, so as to promote health for all countries and their people. So the question of whether withdrawal is possible, and if so, how it would be given effect and under what conditions, is a matter of interpretation and ultimately a question for the World Health Assembly. So how is it, as the questioner asks, how is it that the US has announced its withdrawal if the WHO Constitution doesn't have a provision for withdrawal? The answer is that the U.S., when it joined in 1948, made a reservation where it reserved for itself the right to withdraw. All other WHO countries at the time agreed to this. They accepted the U.S. reservation. Only the U.S. made this reservation. No other member state then or since has made such a reservation. So what about the member states without a reservation? Historically, in the first decade of WHO's history, there were a few cases where member states without a reservation announced their withdrawal. However, these cases were not regarded by the World Health Assembly as withdrawals. The countries involved were regarded as having inactive status. They were not regarded as having effectively withdrawn in a legal sense. The question of how any announcement of withdrawal by member states without a reservation on withdrawal, the question of how that would be handled now in 2025 would be a matter for consideration again by the World Health Assembly. The World Health Assembly remains the correct forum where all 194 WHO member states can work through this issue. Thank you.
Thank you both so much for these explanations. Now, next question goes to political, Carmen Paun. Carmen, please go ahead and unmute.
Thank you so much, Christian. I wanted to follow up on the cooperation with the U.S. on the Ebola outbreak in Uganda. Yesterday, Elon Musk said that they have unblocked, or I don't even remember exactly what he said, but basically they had unblocked some financing for the response to the Ebola outbreak. And I was wondering if you can confirm that, if you've seen any of that money or any technical cooperation from the U.S. happening amid all the fast changes that are happening over here. Thank you.
Thank you very much. Unfortunately, our representative from Uganda has had to leave, so we go over to Dr. Abdi Mahamud, Director at the Interim for Alert and Response Coordination, please.
Thanks. As DG said, we welcome the dialogue and close collaborations coming from US, both US CDC at the field level, both in Uganda and Tanzania, have been given permission to work very closely with WHO, and we have seen the initial announcement from the US to support the response. So we would like to see more because the demand is huge. Uganda has a very strong capability, have responded. This is the 8th Ebola disease outbreak they're dealing, but it started in the capital, and I think it will be very important for all countries to show that solidarity, not only for Uganda, but all other countries dealing with this response. So we welcome that support and we expect more.
Thank you very much, Abdi. Next goes to Alexander Tin from CBS. Alexander, please go ahead and unmute.
Hi, thanks for calling on me. On Sudan virus in Uganda, are you able to provide an update on the investigation of cases without an epilink? And also following up on what Dr. Van Kerkhove said, can you clarify how you think that will impact the upcoming influenza consultation? Thank you.
We start with Dr. Mahamud again.
Thanks. Just to reiterate again, all the confirmed cases, the 9, are all epidemiological linked to the index cases. Right now, the ongoing investigation is to understand better how did this healthcare worker got infected. A lot of preliminary investigation are going on, and then the country is improving. So a lot of people get confused between cases, suspect cases, a lot. As the government improve the surveillance system, we expect to see more suspected cases, more alert coming from the community. All those cases have been investigated and confirmed. The government also introduced additional layers of surveillance called mortality surveillance, where they go swab samples from people who died for non-Ebola disease. And so out of the 200 deaths, they tested all were negative. So while there's a lot of room for improvement, we are confident Uganda has the core capability and it requires support. So just to reiterate again, all the confirmed cases, epidemiological link to the presumed index case.
Thank you. And second part to Dr. Van Kerkhoff.
Yeah, thanks. So there's a vaccine composition meeting that's taking place in a couple of weeks. Every 6 months or so, the world comes together, the WHO collaborating centers for influenza, technical partners, to make recommendations on seasonal vaccine, influenza vaccine composition. They also make recommendations in looking at the circulating zoonotic influenza viruses to identify candidate vaccine viruses that can be used by manufacturers should there need to be these types of vaccines developed for a pandemic related to a zoonotic influenza. That meeting will take place. There are many meetings that actually lead up to the face-to-face meeting that happens every 6 months or so. US CDC and many partners. We actually have national influenza centers in 130 member states that contribute data to this assessment that happens every 6 months to make the recommendation for the seasonal vaccine composition. So those meetings have been taking place. Data has been exchanged. The face-to-face meeting will take place in a couple of weeks, and the recommendation will come. So I think it's really important that that there are several WHO collaborating centers, including some in the United States. They play a major role in the global influenza surveillance and response system. This system has been in operation for 73 years. They are characterizing viruses, influenza viruses that are circulating. They share samples, they share genetic sequencing, they do risk assessments, and they make these recommendations to make sure that the vaccines that are produced by manufacturers provide as much protection as they can against severe disease and death for seasonal flu. But they also make recommendations for viruses that could become a pandemic strain. So we are not in a situation where we're in a pre-pandemic for avian influenza. We're in an inter-pandemic period. So these meetings are really, really critical. That meeting will take place. There will be a recommendation that will be made, and we will make that announcement as soon as that meeting is finished.
Thank you very much. Next question goes to Jamie Keaton from AP. Jamie, please go ahead.
Thank you, Christian. Nice to see you all again. I would like to ask Dr. Tedros. I have a few quick questions. I'm sorry, it's rare that I get an opportunity. So I'd like to ask Dr. Tedros if you could just be specific. In your preliminary remarks, you mentioned that 60,000 people, more than 60,000 people in Myanmar have no access to life-saving services. And you mentioned that the effects of polio and mpox because of the U.S. funding cuts. Could you just be more specific, if possible, about the real impact, the real world impacts of the U.S. Funding cuts? And if I could just ask Dr. Van Kerkhoff, you mentioned that the U.S. stopped reporting influenza data through the WHO global system. Could you be specific about when that was, please? And sorry, I'd just like to slide in one last one. You mentioned that there's not been information sharing from the United States. How much does that remind you of when the United States was asking China to share more information during the COVID pandemic? Thanks.
Thank you very much, Jamie. And can I please remind everybody, because you have a long list of journalists today who want to ask questions, please. I know you all have been holding your questions for long, but please refrain to one question only. So let's see where we can start on Myanmar, or no, then maybe you want to start with the part for Dr. Van Kerkhoff. Is that something you want to start with?
Yeah, I could start on the reporting. I mean, the communication from CDC stopped around the 24th of January. But up until that, I want to be really clear. You know, there are incredible scientists at US CDC and across US institutions, as well as the institutions in all of the member states that we work with. We hope that this exchange resumes soon. We are continuing to reach out to our colleagues in the US government agencies. We haven't heard back from them, but we will continue to reach out, and we hope again that exchange resumes. I want to reiterate that the US has reported human cases of avian influenza through IHR. That has continued. And we do hope that there will be more uploads to the different websites and through the different portals related to influenza, as well as other diseases. So it's not just influenza, obviously, that we're concerned about, but all of them. And this ask is for all of our member states, you know, to continue to do good detection work, to utilize their surveillance systems, multiple components of surveillance systems, because everything that we do in support of our member states in pandemic prevention, preparedness, readiness, response is around surveillance, detection, collaboration, and supporting those capacities that exist in all countries so that we can prevent that next big event from happening.
Thank you very much. And now let me look around if we have Dr. Zakaria maybe for the partner. Dr. Zakaria, to remind everyone, is the unit head for humanitarian and disaster action. Please go ahead, Teresa.
Thank you. So I will attempt to answer the question on Myanmar, but I think it's mostly generally about the needs in Myanmar. And touch a little bit just on the contribution from the United States of America for WHO's work in humanitarian emergencies. What's very important to highlight in Myanmar is the very large portion of the population that has no access to health services. In 2025, close to 20 million people are expected to be in need of some kind of humanitarian assistance, and that includes health services. The focus of WHO's work has really been to increase access to health services in those areas that have been hardest to reach. We still have a long way to go to properly increase coverage to health services, for which donations, funding that is provided by the United States is significant. So the number quoted is a reflection basically of the number of people that we are trying to improve their access to health services. But it's really just a small portion of the entire number of people actually in need of humanitarian assistance in Myanmar. And we do very frequently forget just the scale of suffering and needs in this country as well. Just very quickly to touch on the United States of America's contribution to WHO's emergency operations, we're looking at 39% of the total funding received and available for WHO's emergency operations for the grade 3 emergencies. So that's quite a significant amount. And what it means is that everywhere in any graded emergencies, in any settings, territories, and countries where WHO is trying to respond to these emergencies, it's about increasing access to health services. It's making sure that people have access, they do not face barriers in accessing the services that they need, and that the public health functions are operational. So quantifying those who are directly impacted is a way of showing it. Thank you, and back to you, Christian.
Thank you very much. And next question, we go to Elaine Fletcher from HPW, from Health Policy Watch. And Elaine, please go ahead.
Hi, thank you for taking my question. Regarding the list of impacts that Dr. Tedros cited, maybe you can give a little more detail on the impact of on the Mpox response in Africa, number one, and then secondly on the influenza. As I understand it, Maria Van Kerkhoff said that seasonal flu data isn't being reported through the WHO platform since 24 January, and CDC is not participating in the online consultations. Do you know if the US will participate in the upcoming face-to-face meeting? And is the upshot of this that people in the Southern Hemisphere won't get as good a flu shot next year because the US simply hasn't reported their data on circulating viruses? Thank you very much.
Maybe you want to start with that last part first, Dr. Van Kerkhoff.
Yeah, sure. So the vaccine composition meeting will take place in a couple of weeks. The US CDC or WHO collaborating centers and partners have been invited. Don't know if they will come, but as I said in my previous answer, there are many meetings that actually lead up to the face-to-face vaccine composition meeting. All year long, the WHO collaborating centers, the national influenza centers, there are national influenza centers in 133 member states. They're sharing information about circulating viruses. And all of that information over the course of the 6 months, a year, is actually utilized in making that decision about the vaccine composition for either the Northern Hemisphere or the Southern Hemisphere. So yes, there is a pause in the reporting of information from the US. As we've said, we hope that that resumes. We hope that that technical exchange resumes. But there is data that has been provided from the US as well as from many countries around the world. So it's not just that one meeting where data is exchanged. Data is exchanged over the course of the whole year and for many, many years.
Thank you so much. And for the first part, we go over to Dr. Mahmoud.
Thanks. On the impact of Mpox, DG has already alluded the things in vaccination, but there is also the financial around 7.5 million that was allocated for key critical interventions. It's been impacted. And more importantly is the humanitarian crisis, where a lot of the NGO partners we have in Goma and that depend heavily on the US aid and US partners funding. But I want to reiterate again, it's more than even the funding. As we speak today in Uganda, Global Outbreak Alert and Response Network was started by USCDC and WHO coming together. And through that mechanism, USCDC have deployed almost 842 deployment of US experts to countries that will never have been accessed. So the continuous exchange between WHO, the two sister organizations, has been very critical. So that while we're very happy to see USCDC experts coming to the field, joining us in Tanzania, in Uganda, I think this is a very critical, important collaboration that needs to be further strengthened. It's beyond even the financial, which has direct impact on our partners and WHO, but there's technical collaboration that will be lost for both. Thank you.
Thank you very much. We still have a very long list of journalists. I'm very happy that we have so much interest, but let's see how far we get. Next goes to Sophie Hutchinson from BBC. So Sophie, please go ahead. Sophie, you may need to unmute. And if that doesn't work, let's go to... there we go, Sophie.
Yes.
Please go ahead. Yeah.
Apologies. I just wanted to know, what are the different contingency plans that the WHO has put in place as a response to the freeze at USAID? And how long are you able to fill in the gaps where there are shortages, for example, antiretrovirals? You know, where are those stockpiles? How does it work?
Yeah, exactly. Maybe we want to go to Dr. Meg Dougherty, Director HIV, Hepatitis and Sexually Transmitted Diseases. Meg, can you take that?
Yes, thank you very much. Currently, right now, there are limited waivers that have come forward to be able to allow access to life-saving treatment, including antiretroviral therapies, mother-to-child transmission. But we have noted that there has been confusion in countries, and certainly with the furloughed healthcare workers, some of the services have not been able to get started again. So what we've been doing at our coordination is having contact with countries, ministries, and when there are requests for other antiretrovirals to go to one country or another, we seek support from country to country for sharing. This is a very short-term, limited approach that we did during COVID to ensure life-saving medicines were available. But over the long term, there's going to need to be greater coordination, especially with other resources and some of the domestic resources that are now going into antiretroviral programs. So this will be an evolving story. And I think each day we learn something new. And currently right now, countries and ministries are working very hard to see how they can mitigate the effects. And we are there with them as they do that transition. Thank you.
Thanks so much, Meg. Next question goes to Ginga Tamura from NHK Japan. Ginga, please go ahead.
Hi, and thank you, Christian, for taking my question. My question is, Dr. Tedros, regarding to the pandemic agreement, as the negotiation will resume next week. But on the other hand, President Donald Trump signed the executive order which sees the negotiation. So are you concerned that their withdrawal will have any impact to the negotiation? Thank you.
Let's have the Director General for that.
Yeah, thank you. So for the pandemic agreement, the negotiation will continue, and it's scheduled now to resume on February 17, I think. And then, of course, the last round will be in April. And as you may know, there was a member state briefing yesterday, and the Bureau had already proposed some of the middle ground to address the pending issues. And I hope by April there will be an agreement that could be endorsed by the Assembly in May. So that's what we expect. The pending issues are minor. I think member states will agree to to finalizing this agreement and have a deal by May 2025. This was what they have planned, and hope it will be realized. Thank you.
Thank you very much. Next question goes to Priti Patnaik from Geneva Health Files. Priti, please go ahead.
Hi, good afternoon. Thanks for taking my question. I had two quick clarifications. One is we understand that the executive board has recommended to the assembly that the 20% increase in assist contributions should come through. Do we understand that China has actually agreed for the increase in 20% for assist contributions as per the new scale of assessments? And the second is, if you could tell us a little bit more on a potential creative endowment for WHO. Details are short, so it'll be great if you can sort of talk about the purpose of this. Thanks.
Thanks, Priti. That's for the DG.
Yeah, thank you. So the 20% was agreed by the board, and it was by consensus. And we hope the Assembly will endorse that. On the endowment, as you know, we started WHO transformation in 2017 as soon as I took over. Actually, the first document was prepared in 2018, which outlines a roadmap based on 7 pillars to transform WHO. And one of the pillars was sustainable financing. And the reason for having that sustainable financing pillar was because of the assessment we did at that time, which identified dependency of WHO on few traditional donors as a risk. Because, as you know, if you don't have a broader donor base, if it's a narrow one and you depend on few traditional donors, when one withdraws because of any reason, the organization may not be able to absorb the shock. So that's when we started in 2018 to expand the donor base. And to expand the donor base, we proposed a long list of solutions, actually. But the 3 that popped out then, I mean, the clear ones were first, increase in assets contribution. That means all 194 member states to increase their membership fee. And then the second was starting an investment round. And this is a voluntary one that all member states can participate, but beyond even member states, including foundations. And the third was the establishment of the WHO Foundation to tap into the private sector, because WHO cannot mobilize resources directly from the private sector in order to avoid the conflict of interest. Of course, there were additional advices at that time or additional ideas that were proposed. One was cost recovery. We provide services, and there are services we provide to institutions or people who can pay. So cost recovery was one. And at that time, there was talk about endowment, but that was not really a clear decision then. But it was one of the options also considered. So the whole purpose of the sustainable financing, as I said earlier, is to broaden the donor base. And the member states are now supporting us with that. And as you know, the assess contribution, they have agreed to increase by 50%. And this is the second installment, by the way. The first installment was already done by member states. Investment round has generated some resources. WHO Foundation has generated some resources. Some cost recovery has been done. And our donor base actually is on the increase. And if we have endowment that will further help us in sustainable financing, especially when we talk about resources, by the way, and broader donor base. The quality of the funding improves. And it's not just about the amount of money, but it's about the quality of it, which empowers WHO. Because when the money is flexible and when it's drawn from a broader donor base, then WHO can use that flexible funding to support countries based on the priorities. For instance, support countries based on the SDG priorities, so countries can achieve the health SDGs. So the endowment, as you said, could also help. On the endowment is one thing we discussed during PBAC, an endowment of $50 billion, if we can establish that, that's what we're targeting. That could also contribute to the resource WHO will access. But that's at an early stage. We depend more on the 4 instruments which I have already told you, and those instruments have started to deliver. So we will continue to use those instruments at hand while working on the endowment, which is still at an early stage and still an idea that hasn't moved much. But that definitely will help us in getting more resources, more quality resources that can empower WHO and help countries based on their priorities. Thank you, and Christian.
Thank you very much, Dr. Tedros. Next question goes to Sonia Wind from Bloomberg. Sonia, please go ahead.
Hi, thank you very much for taking my question. I was wondering if you could talk a bit more about the countries that might step up their funding in response to the $1 billion funding gap from the US. You could give some more specifics there. That would be great. Thank you very much.
Yeah.
Dr. Tedros.
No, I cannot tell you specific countries that will increase their funding, but as I said earlier, we have these instruments. This is the investment, the assessed contribution, the investment round and WHO Foundation and other instruments. We will use those to mobilize resources. During these challenging times, we have now 3 goals which we identified. One is mobilize resources using the instruments we have, thanks to the reform, actually, that we have instruments now. The second is to tighten our belt or efficiency gains. And the third is continue to engage the US. So it's mobilize, tighten the belt, and also engage. And we're working on all 3 fronts. And we hope the outcome will be good.
Indeed. Thank you very much. I believe we have 2 more questions on the line, so we may just make it to all of them. Next goes to Jenny Leravello from Devix. Jenny, please go ahead.
Thanks so much, Christian. 2 quick questions for Dr. Tedros. Can you just clarify the endowment fund? Is it $50 billion or $50 million? And then for Dr. Kirkov, you mentioned that the US is still reporting data to IHR channels, but also you've been trying to communicate with US counterparts. Just want to ask if what kind of information are you not getting from those public information that you're trying to ask US colleagues, but you're not getting at the moment? Thank you so much.
Yeah, thanks, Jen. Not sure how much details we have, but let's get started.
Colleagues, but you're not getting at the moment. Thank you so much.
Yeah, thanks, Jen. Not sure how much details we have, but let's get started.
Okay, just very brief on the endowment. So, as you know, there are many organizations who have endowments. For instance, one example from Europe is Wellcome Trust. It has more than 40 billion, I think. And still, I want to make sure that you understand this. This is just an idea, and it hasn't really progressed much. Still an idea. And the idea is for WHO to have a $50 billion endowment And this could generate, as you know, endowments of 50 billion, for instance, can generate 3 to 5%, which is equivalent to 3 to 5 billion US dollars annual. I know 1.25 to 2.5 billion annually, meaning biennial will be 3 to 5 billion US dollars. So that will be a good addition to the resources or revenue of WHO, if that can happen. But it's not going to be an easy task. But one of the well-run endowments is the Wellcome Trust, which is based in the UK. But there are many other examples of endowments, by the way, and they could generate 3 to 5% annually. And but I want to again say, this is just an idea that hopefully will be realized, but we haven't still started to get into action. This is an idea that we're putting together and try to understand how we can make it happen, and hope our member states and other partners will help us realize it. Thank you.
Thank you so much. And for the second part, let's see what we could get in details from Dr. van Kerkhove.
Yeah, so I can start, but others may want to come in and supplement this. So, U.S. colleagues contribute to many different types of information exchange with us. So what I was referring to with influenza, there's data that can go on databases online in reporting systems that exist globally. I mentioned Flu ID, I mentioned FluNet, but the data that is published on the CDC website across a number of different diseases is information that is still needed for a number of different programs. But CDC and other U.S. experts also participate in advisory groups. They participate in expert network discussions where we are developing evidence-based guidance. There are meetings that have been taking place looking at different types of research for Marburg, for Ebola, for Mpox, for many different types of really critical technical outbreaks that are happening right now. And that's the exchange that we are asking to continue. So while all of these other things are being worked out, the technical exchange between scientists, between collaborators, whether this is happening at a global level, at a regional level, or in country as part of a response or as part of preparedness efforts, that's the exchange that we want to resume. But others may want to come in on that.
Thank you very much, Dr. van Kerkhove. And I think we have time for one last question, and that goes to Gabriel Emmanuel from NPR. Gabriel, please go ahead.
Thank you so much for doing. I'm sorry to ask one more question about the U.S. and the dynamic between the WHO and the U.S., but I'm really curious because President Trump has made some very specific criticisms, concerns regarding payment and leadership and such, and he has also left the door open to rejoining the WHO in kind of hints here and there, saying, we'll see what happens, that type of thing. I've also heard experts who've said the WHO needs to be a bit more aggressive in pursuing Trump to get back to the table. So I wanted to hear if you could respond to that critique and also say kind of what you are doing to get Trump back and to get the US back. Thank you.
Thank you, Gabriel. Let's see what we can say about this. Dr. Tedros, is that for you?
Yeah, thank you. I said the 3 strategic goals are mobilize resources, tighten the belt, and also engage. So it's within our own goals, and that's what we're trying to do. Of course, without formal engagement or without engagement, you wouldn't know what would really help in terms of continuing the cooperation and, for the U.S. to reconsider its decision. On the issues you raised in the executive order, I can give you some examples. For instance, one is it asks about WHO's reform. Of course, we believe in reform. We believe that change is a constant. We believe in continuous improvement. And since I started, we have initiated the biggest transformation initiative in the history of the organization, and the 7 pillars I said earlier. And many of those initiatives are happening, changing the organization, preparing it for the future. For instance, our investment in science, in data, and in technology is forward-looking, and that will be game changers, and that will really shape up the organization and prepare it for the future. So we have been doing that. But still, if there is more reform idea from the US, they're welcome. We're actually asking for it. We have been asking for it. So if there are good ideas, we would be happy to take those. So I don't think this should be a reason. It should be actually a reason to cooperate. And then the other issue is payments. Of course, in the executive order says US pays disproportionately. Of course, we thank the US for its generosity. I know the US generosity and leadership, not just as DG of WHO, but when I was working in Ethiopia as head of department, as Minister of Health, and so on. That actually helped me when I was minister to transform the health sector of Ethiopia. So I'm really grateful for that, and that's why I feel sad when US is decided to withdraw, because I know its leadership and impact at country level and the same at global level. But when it does this, of course, this is, wants to help the rest of the world, but at the same time, the US also benefits from it. But if the US wants to pay less, it's actually in line with what we're doing as part of our reform, because we have started in 2017 the sustainable financing reform that is helping us to broaden donor base. And when this succeeds, the contribution of traditional donors, including the US, could decline. Of course, it will take some years, but it will decline because the burden will be shared. So if this is what the US wants, then again, cooperation and being with WHO will be the answer, meaning we're asking exactly the same thing. We're asking share burden, and the US is saying share the burden, so there is no difference at all. And we started this seven years ago. And if there are other issues they raise, we are building a transparent organization, an accountable organization, a responsive organization, and we would respond to any queries or issues there are, and we hope US will reconsider and work with us to continue the reform that we have started seven years ago. And I think that would be actually one thing we expect as part of our goals now for the US to come back, but look forward to their engagement.
Thank you very much, Dr. Tedros, and thank you all very much online and here in the room, and to those many questions. We managed to get through a long list. Apologies to all those who we haven't managed, because the interest today was very high. We've come to the end. We will be sending the audio files and Dr. Tedros' remarks as soon as possible, right after the press conference. Any questions that may remain open, please follow up with media inquiries at who.int. And with this, back to the Director General for closing.
Thank you, Christian, and thank you also to members of the press who joined us today, and see you next time.